You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real. It's Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. Now, these people are still stuck on stupid. Folks, Alabama breaks its record for most deaths in a day. The governor of Oklahoma, he has tested positive for the virus. And remember, he was the one last month who tweeted, "Hey, packed restaurant, y'all come on out." Walmart now says it will now require all customers to wear masks at all times. And y'all love this here. Peter Navarro, who handles trade for Donald Trump, writes an op-ed attacking Dr. Anthony Fauci. Then the White House says that Navarro was acting on his own accord. The LA Times, though, is reporting that Donald Trump approved of the attack on Dr. Fauci. As of today, there are 3.48 million confirmed cases of coronavirus in the United States. Just a few moments ago, I'm going to try to leave that graphic up, folks. Mark Lamont Hill apparently sent out a tweet that said he now has coronavirus. Let me see if I can find that. I was coming in, and someone alerted me that here it is right here. Go to my iPad. I've been fighting COVID-19 this week. It's been tough, but I'm managing and self-quarantining. Please wear masks. Please observe social distancing. Please stop sharing conspiracy theories and bad science. Folks, there are 1.3 million people who have recovered, and 138,000 Americans have died from coronavirus. Joining us right now is Dr. Ebony Jade Hilton, Associate Professor of Anesthesiology and Critical Care Medicine at the University of Virginia. Doc, glad to have you.
Good to see you. It's been a long day.
Yes, I understand. We were chatting and texting last week, and you talked about how in the emergency room in the ER there at the hospital, it was a Friday night, where y'all just got deluged with folks. And then I saw somebody tweet you about all of these bars that were open in Charlottesville and how the folks were just packed into these bars and restaurants.
Right. I mean, that's across the board. You know, we're seeing more and more people getting infected. We're seeing younger people getting infected. And I think the thing that we have to realize is that previously we would say, you know, it's elderly people and those with pre-existing conditions. Those are the people that need to watch out. But when this virus starts to hit this deep south, what we know is that young people have these pre-existing conditions. Young people have obesity down in the South. Young people have hypertension and diabetes down in the South, pre-diabetics down in the South. You are the persons that we're speaking about. When we talk about people, for instance, in Atlanta, we have a high incidence of asthma related to the traffic and the air pollution and smog and air quality, whatever you want to call it, you have a higher incidence. And so those persons, if you get coronavirus, your chance of not only having a worse outcome, but literally having death is increased, regardless if you're 20 years old, 30 years old, 40 years old, or 80 years old. Yeah.
This is, I mean, what's happening here, what we are seeing, what we're experiencing, again, from Dr. Fauci keeps saying, is that people don't want to pay attention. And it's frustrating to medical professionals to have people who just refuse to social distance. And all these people, it's our freedom, it's our right, and not understanding that you're able to track it. I mean, you're able to, they have contact tracing where they say, okay, this explosion, this cluster, this outburst happened because of this event, this party. And people are just sitting here living in denial because I think a lot of them are thinking like Trump, oh, this thing's just going to go away. This thing's just going to go away.
Right. And it will go away with them being infected at the end of it. And that's the thing. You know, we're starting to see more and more politicians become positive in states where they were really lax about their preventative measures. And so I'm hoping those states, now that those persons unfortunately have felt what it feels like to have COVID, they will start to try to protect more of their people. But you know how people have a very short memory span. And what I'm nervous about is that once they get over their COVID experience, that it'll go back to the same political games that got us here in the first place.
But let's talk about that, because I saw one story where it said that they are discovering a lot of these folks who have survived coronavirus significant heart issues.
Mm-hmm. Oh, yeah, for sure. And like I said from the very beginning, there's a lot of times that people keep saying, oh, you're only reporting the deaths, but you're not reporting those who've recovered. And we can talk about the percentage that are recovered. Yes, in the United States, we have listed 92% of those who have closed cases now have recovered. But in that recovered group are people that have had massive heart attacks, that have had massive strokes, that have had limb amputations because they had blood clots in their legs or their arms. There are people who are now on permanent dialysis because they have renal failure, permanent use for oxygen because they have scarring of their lungs. So yes, they are recovered, but their life will never be the same. And that's what we have to keep in mind.
And that point that you just made right there, I think is critically important because, again, when I look at the critics, the critics of the shutdown, they keep saying, well, this state only has X number of deaths and X number of deaths here. But it's the continuing health issues that people have who have contracted coronavirus. And what we're now seeing, this explosion, after 2 or 3 months being told, young people, don't worry about it, y'all good. They're now making up all these coronavirus cases. Now I'm realizing that was some stupid advice.
Right. And like I said, because not every young person is equivalent, right? You have some of your young people who are Olympic athletes, and then you have some of your young people who are not. And I'm going to leave it at that. And the point is that our bodies, based on that, behave and will behave differently. And so you can't go based on an age. You can't say, oh, I'm 32, I should be completely fine. I don't want to have to talk to your parents and tell them that you didn't make it. So do simple things. Wear a mask. Stay home as much as possible. If you are out, stay socially distanced as much as possible. And don't do careless, reckless things. It's not worth your life. It really isn't.
Got questions from our panel. We're going to start with Dr. Carter.
Oh, thank you. So I was curious, now that we've had all these cases and you're talking about these lingering effects, is anyone keeping track of what people's post-COVID lives are like, or are we just tracking the number of infections, the number of people cured, and the number of people died?
Right. And that's a very good point, because I think it would be fantastic to see and trace. For one, because we're going to have these people potentially on the disability list now, right? And what does that do as far as our economy and really having an employment status? Because you got to think that could be a potentially large portion of people. Now, we see nationally the federal lead of making a standardized protocol is not happening. Even within states, we see that different hospitals have different strategies of testing and the way they're approaching things. So, yeah, it needs to be, but is it in place right now? No. What we currently know is that still not all states are even reporting common, simple things like race and ethnicity. In fact, in Texas right now, only 9% of the cases have a race or ethnicity tied to it, 9%. And they're in a major hotspot right now. So yeah, that type of data I think is going to lag for quite some time, unfortunately.
Scott.
Hey, Dr. Hilton, Scott Bolden here. The complexity of this disease that I've read about is enormous. It's more than just a respiratory disease. I've read where it can trick your immune system into attacking your body and your organs. We see where we have heart failure. We have people and their limbs are being affected by this, whether they survived or not. Does the complexity of this disease mean that we're further or closer to developing a vaccine, or does it make it more difficult to develop a vaccine sooner than later?
Right. So very interesting point. For one, we know that there's been studies now looking at for known positive patients. Let's look at their blood to see if they're producing antibodies, for one, and then for how long are these antibodies, these neutralizing antibodies, actually within the person's blood system. And what we're seeing is that for a good majority of the patients, antibodies, the neutralizing antibodies that you need to really rid your body of the virus, is only present up to 6 to 8 weeks.
Wow.
That's less than ideal.
Yeah.
So what does that mean in terms of vaccination? What we know is that Moderna, and I'm sure you guys have been following this, they just released their phase 2 results. They tested 45 people with a vaccine, and they had minimal side effects, which is fantastic. But we got to go through phase 3, and of which most of the programs, about a third of the programs that do these vaccine trials end up failing. So we'll see.
Right.
But what they said was that they did see that people were starting to produce the antibodies. How long the antibodies are going to last for, and for this person to be to have some form of immunity long lasting, is unknown at this point. And also what they recognize is that you had to have 2 doses of the vaccine to mount that level of response.
So Roland, let me ask you just real quick follow-up is this, because on the street and with my buddies, we all say when they get a vaccine, Dr. Hilton, we don't want to be the first, or we shouldn't be the first to take the vaccine. True or false?
You know, I hear people say that all the time. And
that's for my Morehouse buddies out there.
And I do. I completely understand why there is a fear of unknown. I mean, we all have that. Now, it is one of these circumstances where you hear a lot of, stories of, oh, they're giving you the virus, and that's not what this is. And particularly with Moderna, they're literally giving you a piece of it. It's an mRNA virus. So they're giving you a piece of that for the vaccine. In this circumstance of where we don't have really good treatments of if you do get coronavirus, how to win that battle for you, then your best bet is to try to have something that can produce some antibodies to rid your body of this virus as soon as possible before that cytokine storm. So you asked earlier about how the virus causes you to turn on yourself. And what it causes is an intense inflammatory response. And it's that inflammatory response that's causing, instead of just the lungs to be involved, the lungs, the heart, the kidneys, everything, because of the way that it impairs your overall blood flow to those states. So because of that, for me and mine and my family, what we will be doing is, as soon as there is a vaccine in place, particularly in healthcare, we have to do those anyway. We have to get a flu vaccine every year. As far as our standard protocols, we will be getting one. Because we want to live. And it really is kind of that simple. People are dying. We will be by 140,000 dead people in the United States within either tonight or tomorrow morning. I have zero doubt on that.
Robert Patillo.
You mentioned the cytokine storm, and part of the therapeutics are things such as remdesivir, which is supposed to prevent the inflammatory response. And there's been research done from the SARS virus in 2002, even MERS in 2015, regarding the effects of the anti-malarial. And that's kind of what Trump got really intense about with hydroxychloroquine and chloroquine. What other potential therapeutics are there that may be able to help reduce the most severe reactions to this virus?
Right. So fantastic question. So as far as agents, remdesivir is what we're using actually at my hospital here. And what it does is it inhibits the RNA-dependent polymerase. So basically the way that the virus kind of copies itself, right? And then the other agents that we're using is dexamethasone. So it's a steroid. And that steroid is supposed to help stop and slow down that intense inflammatory response that we're seeing that, again, impairs the heart, the lungs, the kidneys. Those are the 2 agents that have been shown to be the most promising. And it's all we got right now. So I'm hoping that it'll be effective for the majority of people. But it really is one of those things that it's so early on. For one, we're seeing more and more children being impacted by this. For 2, for instance, in South Carolina, we've now lost 2 young children within the last week. That's my hometown. So yeah, in Florida, 7,000 children testing positive. What do we do with that? Because again, when we're comparing our population to the population of China and Japan, we have different health issues over in the United States at baseline. We know hypertension, diabetes, obesity, it lives in our country, where it's not as prevalent in other countries. So we can't look at their outcomes and think we're going to be the same. We have a hill to climb. And I'm hoping we can just stay off of the hill altogether.
Got to ask you this question. We now have the Donald Trump administration now saying bypass the CDC, these hospitals when it comes to sending data. Is that a recipe for disaster?
And you know that's a rhetorical question. You know what I've said from day one with him, pray for him. The works of this pandemic, there's been this tug of war between economy and biology. And from day one, I've said biology will always win. It does not care what the stock market is looking like. It does not care what your bank account looks like. It does not care if you're employed or unemployed, Republican, Democrat. It does not care. And playing these games is what has led us here in the first place. So it's going to come down, unfortunately, for states to start saying we're going to take our own lead and initiative with this. But unfortunately, like we know, most of the South, we know which way it leans. And we are now starting to see that more and more. Those states that have certain leadership in place are having skyrocketing cases, like in Florida, where we have an increase of 1,300% in their positive cases, 1,300 since reopening. And they're daily having 10,000, 11,000 new cases a day. So this is not good, especially in a retirement state. We know that there's the elderly population in those areas, and many people have the potential to die.
Well, you talked about those state measures. Virginia Governor Ralph Northam tweeted this today, breaking: in the absence of federal action, Virginia has just become the first state in the nation to adopt enforceable workplace safety standards for COVID-19. Workers should not have to sacrifice their health and safety to earn a living, especially not during a pandemic. The fact that we have not had those, here we are in July, that again speaks to why this continues to be a problem. People open up, and then all of a sudden folks go back into the workplace, and you don't have enforceable standards to protect folks. I mean, one of the things that we've done, we practice social distancing here, where we, a worker in this room, we actually changed our control room, moved desks much further apart. We wipe everything down. We spray. Folks in the control room wear a mask. I don't wear a mask when I'm doing the show, but I'm the only person out here. And so how we keep, but again, you got to have some damn leadership from the top. That's the fundamental problem.
Right. And also, I think we're doing the nation a complete disservice, because there hasn't been a clear message to employers even to say this is how you can structure your small business in a really clear and concise, consistent manner. These are some options for you. And regardless if you're in Virginia or you're in Texas, those options are the same. The virus is the same in every state. So we need to be clear. I think the medical community is trying to be, and that's why with Trump, trying to belittle and dismiss Dr. Fauci, who at this point has been the most vocal and the most trusted medical leader in our nation, that is negligent, in that it starts to make people doubt the process that can literally keep them alive, and that has to stop.
All right, Dr. Ebony Jade Hilton, go get some sleep.
I know, I'm tired.
Always glad to have you here. We appreciate it. Thanks a lot.
Thank you. Yeah, have a good one.
All right, thanks a lot. Again, bottom line, Robert, there's no leadership. You don't have leadership at the top. I mean, Donald Trump does not give a damn. The fact that the White House is literally attacking your top expert. Really? That's your enemy. Fauci's now the enemy.
What are we in grade school? We're in grade school now.
Well, Roland, this is what happens when you see Joe Biden opening up a 15-point lead nationwide. Donald Trump really believes that his only shot at winning is for people to just ignore the virus, to pretend that none of this is happening. He even is retweeting Chuck Woolery. So you have a game show host who is president retweeting another game show host to discredit the leading epidemiologist in the world, saying that everybody is lying to you. So we've entered the twilight zone phase of this pandemic, and the leadership has to come from the state and local level. Even red state governors like Kemp in Georgia, DeSantis in Florida, Abbott in Texas are learning that you cannot just BS your way out of this situation, that the virus is real, and now they're taking those ambulatory efforts to help fix it.
It is stunning to me, Scott, to watch them. Peter Navarro, the trade dude, attacks the doctor. If you need any better example of how this administration hates science, this is it.
Yeah, you're absolutely right about it. The other thing that's really dumb about all of this is that we've given millions, billions away to help people and businesses get through this pandemic, right? And then you turn around, know that you're not going to, you don't have a vaccine, you know that your numbers are going down, and then you jump the gun. The Republicans jump the gun in these various red states, and the president says, go back to work, put your children in school, and then you see where the numbers are going up because the beaches are open and the bars are open because leadership, however you define it, is telling people, the American people, that it's safe to go in the water and the bars. And guess what? Now the numbers are going up. Nobody's surprised at that. And now they don't want to give any more money to the American people and the American business community because they either don't have it or they believe that it's too rich and enduring. Yet at the same time, you're driving this narrative that you don't care, you don't believe in the pandemic, and so you're causing us to lose money. All of the government funding that they've put out has been a wash and a waste because the pandemic is back. It's like 1A or reset. And by the way, we haven't even gotten to part 2 of the pandemic in the fall and winter, which they have anticipated and predicted. And so it's just really dumb, you know? And they're deaf because they don't listen. They're dumb because they don't comprehend. And it's devastating because 135,000 people have died, right? This is the best argument for Biden or new leadership come November. If you need more than what I just gave you, then you've been walking around with your head in a bag or your head in a hole.
Dr. Carter.
I mean, I think there's nothing more to say here besides the fact that we know this is what Donald Trump does. Whenever he's losing, whenever he feels like someone is not on board with him or his bad ideas, he tries to discredit. He tries to manipulate the public into thinking that all of the institutions that are here to work for you, if it's not the CDC, it's, the CIA or some other organization, they're all here to hurt you. And I'm the only person with the absolute truth. And I think it's unfortunate that you have real professionals who actually care about the public health having to work with an administration like this one. And I think what we're going to see is this sort of anti-science drum that Republicans have really been beating for over 20 years now is going to bite us in the butt one more time because as Scott rightly points out, we have more people dead that can fit in FedEx Field right now, and that fits 85,000 people. And that happens because you have people who are more concerned about poll numbers, more concerned about businesses than they are about people. And
the virus doesn't care about any of that.
Right along there with them.
All right, folks, back to our Roland Martin Unfiltered video in just one moment. All right, folks, the folks at Seek.com have an incredible offer for you folks. And these are these 360-degree 4D headphones that you can use for music, you can Bluetooth, you can for gamers, all that sort of stuff. Mary Spiels, a sister, she's actually the inventor of these headphones. Phenomenal. I love the sound of these. They also have the virtual reality headsets, which allow for you to actually watch VR virtual reality videos, 360-degree videos. You just simply pop your phone right into here. And then, of course, if you you can also go like YouTube has an app as well that has a channel that deals with a lot of those VR ads. And so you can actually do all of that, folks. Check this out and pop it on. And guess what? Check out your virtual reality videos. Go to Seek.com, 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 Seek.com. Use this promo code right here, RMVIP2020, RMVIP2020 for a discount on these headphones. And then, of course, when you support them, you support this show, Roland Martin Unfiltered.